Well, as you heard on the news, the number of COVID-19 patients in intensive care in Saskatchewan has reached an all-time high of 84. Premier Scott Moe announced this morning that 6 COVID-19 patients are being transferred to Ontario over the next 3 days. Moe also said the province will be asking for additional resources, including medical staff, from the federal government. But there is some positive news. The 7-day average of daily new COVID-19 cases in Saskatchewan has dropped. The province is currently averaging 340 new cases a day compared to 486 cases a day a week ago. As for other numbers, there are almost 4,000 cases considered active around the province, with Saskatoon, the Northwest, and Regina having the most active cases. Almost 777,000 people are now fully vaccinated in the province, and it sounds like a vaccine for kids could be available soon, although no date has been set. As always, it's a lot to take in, so clinical microbiologist Dr Joseph Londo is back to get us up to speed on some of the latest research and to take your COVID-19 questions. So you can give us a call right now. It's 1-800-716-2221. You could also email bluesky@cbc.ca or tweet us at blueskycbc. Now, we're also live streaming today's program on the CBC Saskatchewan and CBC Saskatoon Facebook pages, so you can ask your question in the comments section on Facebook. Please remember, our guest is not part of the policy decisions made by government. He's speaking to us as a microbiologist and an expert on infectious disease. So again, we're pleased to once again be joined by Dr. Joseph Londo, head of microbiology at Royal University Hospital, teaches about infectious disease at the University of Saskatchewan. He's on the line now. Dr. Blondeau, thanks again for your time.
Oh, Garth, it's my pleasure. Thanks for asking me to come back one more time.
In general, what are your thoughts on where we are at with COVID-19 right now in the province?
Well, I think we're in a spot that we need to be concerned about. When we get to a point where, we see ICU admissions being where they are, plus the overall admission rate or hospitalization rate for individuals with COVID that are hospitalized, aside from those that are in the intensive care units, also concern, and the fact that I don't want to sound like I'm continuing to beat the same drum, but the fact that that the vast majority of individuals that are involved in this current wave are amongst the unvaccinated population should give everybody pause to reflect on where they are and whatever decisions they're making, and whether or not they really need to contribute to controlling this pandemic by getting out and getting immunized. That's still going to be our best course going forward in order to start to see these numbers really come down. And I think that we still have a lot of people in the province that remain unimmunized, and they're going to serve as, a potential reservoir for continuing transmission of the virus, or sadly, some of them may end up being infected and hospitalized, and even a few in the intensive care unit. So I hope it's an awakening, but I know we've struggled to get our vaccination numbers up.
Now, on vaccinations, a question that we've been getting via email just about daily is when you look at the numbers and you look at the pie chart, as you mentioned, the vast majority of hospitalizations are unvaccinated, but an interesting percentage are fully vaccinated, 18 to 20%. Yep. Why is that?
Yep. Well, because breakthrough infections have been recognized for a number of different reasons. The first one is that it's been known since the vaccines were first released for use in the public that they weren't 100% efficacious. So that's point number one. Point number two, we know that immunity wanes over time, and whatever that contributes to this particular problem actually remains unknown at this point. But if you look at the largest data set that's available for review, and that's out of the United States, they actually show that where breakthrough infections are occurring and having significant consequences are, again, in people over the age of 65 and in individuals that seem to have some underlying comorbid illness, whether it's diabetes or cardiovascular disease or whatever the case may be. And so as a consequence, even if you're fully vaccinated, but you still fit in those higher risk groups, there's still a possibility that you become infected, and in some of those people will actually end up requiring elevated levels of care. So the message there still has to be that in addition to vaccination, if you're older and if you're in a higher risk group, you still need to be taking some of these additional precautions.
Okay, we've got a couple of sort of related questions on Facebook I'll go to first. Jeremiah writes, is it not true the vaccinated are asymptomatic spreaders of the virus?
It certainly can be true, yes. Although some will be symptomatic, others may be asymptomatic, and you won't know that unless you're tested.
And a related question here, is it true that even though you have been double vaccinated, you can still transmit COVID?
Yes, you can. Yes.
Okay, well, what do you say to those then who hear that and say, well, what's the point of getting vaccinated?
Because the one thing that the vaccine does is it reduces the likelihood by 80-90%, maybe higher, that you'll end up with serious infection requiring hospitalization or admittance to the intensive care unit. Again, I said earlier on this show months ago, Garth, I don't think anybody cares that they end up getting the sniffles. Maybe if you end up getting a little bit of a head cold and that is your experience with COVID, take it and be grateful for it. But if you're unvaccinated, the likelihood that you could actually go on to have more severe disease, we've seen this repeatedly in the numbers, is much greater. So being vaccinated protects you from more severe disease. Plus, if you're asymptomatic, you're less likely to be spreading virus than somebody who's symptomatic. So the scenario would be, if I'm positive and I'm coughing and I'm sneezing, I'm much more likely to transmit the virus than if I'm positive but I'm not coughing and sneezing.
Okay.
And so the vaccine is important, and it makes a difference regardless of what the naysayers might put forward.
Okay, let's go to the phone lines. We'll start with Darren in Regina. Hi, Darren.
Hi there.
You go ahead, Darren.
This segues nicely into my question is, people that have had coronavirus and recovered, say it was, previous to the Delta variant, consider themselves to be, have natural immunity. Is there enough research and study to say that that's as effective, or what's the latest kind of update on that situation for people that, and I know some people that don't want to get the vaccine because they think they have natural immunity?
Yeah, great question. So there is data that's available, and what that data shows is that if you look at people who are naturally infected, they don't all necessarily have the same robustness of their immune response. So in other words, say somebody who had a mild infection may not necessarily have the same level of antibody as somebody that had perhaps a more serious infection. That's not a uniform statement, just to be clear. But what the so-called experts are actually saying is that even if you've had natural infection, the only way to ensure that you have a healthy and robust immune response, in other words, a good level of antibody, is to complete the vaccination course. So it's still recommended that regardless of whether you've had natural infection or not, you become immunized.
Okay. Okay, let's just move on to Lana in Regina. Hi, Lana.
Hi, I'm actually around in Saskatoon, and my question is pretty much identical to the one that was just asked. So maybe a further question would be, why would we not be doing more antibody tests, both with those who haven't been vaccinated but did actually get the infection, and those of us who have been vaccinated, given that we also know that my immune response may not be the same as your immune response to the vaccine, right? Because there's also variations in terms of how our bodies react to the vaccine. So why would we not be doing antibody testing as one option, so that if there is sort of a certain level of antibodies in the person's system, that they wouldn't require to have the vaccine?
Yeah, so this is an area that still has a lot of confusion to it. Certainly there are antibody tests available. I don't think any of them are perfect, and the possibility of false negatives, false positives, etc. exists. But I think a more fundamental problem is, how do you interpret if somebody has a positive test indicating that they have antibody, and the antibody level is low, for example. Every test has a cutoff. Every test has a threshold, below which we call it negative, above which we call it positive. And so I think we use this analogy, Garth, back a few weeks ago. Let's just say both of you and I went and we got our antibody tested, and for whatever reason, I had a low level of antibody detected and you had a high level of antibody detected. Does that mean that you have better protection than I do? And we simply don't know the answer to that question at this point in time. So I think what the strategy has evolved to be is that we want people to get immunized, because following immunization, we know that most people, over 90%, have robust antibody responses. And so we know that they have a level of protection. And you cannot predict how good that level of protection is from an antibody test at this time, based on my level of knowledge of this testing.
Okay, Lana?
Yep, sounds good. Thanks.
Okay, thanks for the call. Thank you. Got a question here. Oh, go ahead. Dr. Blondeau?
No, I was just saying thank you to her.
Okay.
Sorry.
We've got a question here from Kathy on Facebook. Kathy wonders if it's safe for someone who got myocarditis from their first Pfizer shot to get a second shot of AstraZeneca.
So my understanding is, in general, yes. But I know that this is information that you should bring forward to your healthcare provider in order to look at your case specifically. I don't want to just make a blanket statement, yes, because again, without knowing, somebody's complete medical history, there might be something there that somebody else could appreciate more than me. In general, my understanding is yes, but I would consult with your healthcare provider just to make sure there's nothing about your past medical history that would elevate your risk.
We'll go back to the phone lines in a moment, but since we've been talking about vaccinations, for a lot of people in Saskatchewan, especially older people, it's been 5 or 6 months now since their second shot. What are your thoughts on the need for a third or booster shot or additional vaccination?
Garth, there's conflicting opinions coming out from various bodies in regards to this. We know that booster shots are already currently recommended for people that are considered to be at elevated risk. So these are people that are immunocompromised or on biological products that suppress their immunity, etc. But I think that we are actually, based on what I understand, I think we're probably moving both in Canada and the United States towards booster shots, because there's some evidence that's coming out from some scientific community showing that, antibody levels are dropping off. And because we don't know the absolute minimum antibody level that's necessary in order to offer protection, there's probably going to be a movement afoot to promote booster shots. I can't say when that's going to happen. I can't even say if it's going to happen, but I have a sense that it's probably going to happen.
All right. Back to the phone lines where Anna is in Saskatoon. Hi, Anna.
Hello.
Yes, go ahead, Anna.
Hi.
Well, my question is regarding vaccine hesitancy. Like my family and I were all in favor of the vaccine. We have all gotten our shots. But, I have friends who have not gotten their shots. And so my friend, she has an immunodeficiency illness. She has lupus, among other illnesses. And so she is very reluctant to get the vaccine. And when she has gone to her doctor and other doctors, she has said, okay, I have this and this and that. Is the vaccine good for me? The reply she gets is, it's up to you to get the vaccine. It is your choice to get the vaccine. So do you know something about these conditions and whether the vaccine is safe for these kind of people? That is my question. Initially, I wanted to know why is our government not telling us more facts about the vaccine, because many of us, we believe in the vaccine and its power to get over this pandemic, and we just take the word for granted. It's safe. Okay, we use it.
Yep.
But other people do not believe like that.
Yep. So I understand your question only too well, because we get this all the time. So first of all, when you look at how these vaccines were studied, like a manufacturer, for example, say a Pfizer or a Moderna, will not come out and openly promote the use of a vaccine in a population that has not been studied to a large enough degree that they have data on which can guide some of their recommendations. So they're not likely to come out and make strong recommendations about any particular subpopulation because they just don't have the data on it. So then that then defaults to expert working groups, expert clinicians, those that are experts either in family medicine or infectious diseases or whatever, to look at the vaccine and then look at the populations that are at risk and to try and make a recommendation as to whether or not the vaccines are safe in those populations. And of all the data that I have seen, there are lots of people, as I understand it, who have significant underlying medical conditions, including some of the ones that you have mentioned, who have been vaccinated. And I'm not aware of any data, and I'll stand corrected if anybody has any, I'm not aware of any data that the vaccine is unsafe in these populations. But again, some people will stop short of just making a frank recommendation only because there isn't an enormous amount of data out there in which somebody can hang their hat on. However, I will say this, the risk of getting infection with some of those underlying medical conditions and ending up with serious disease is likely much greater than any risk associated with taking the vaccine. So it is an individual's choice to take it, but they should take it from an educated perspective by somebody that's qualified to give them that information.
And who else can she approach? Because she's already gone to her doctor, her medical doctor, and also other doctors, and they have all replied the same. Where can she access these subpopulation research or groups?
So she can contact one of the vaccine centers and say that she has some concerns and ask to speak to a healthcare provider that has expertise with the vaccine. And then somebody can try and fill in those questions for her or him, whoever the person happens to be. I do know earlier in the pandemic, there were a number of us that were at the vaccine centers, and we were trying to answer questions from individuals that had concerns over vaccines, that had some hesitancy. And I do have to say that the majority of people, I think, who asked questions and had them answered appropriately, decided to move forward to get their vaccination. And there were some who just refused. But I do think that having good information communicated is part of the solution.
Okay, awesome. Thank you so much.
All right.
You're welcome.
Okay, Rob is on the line. He's in Humboldt. Hi, Rob.
Yes, Dr. Blondeau, I have a few questions for you. About 5 years ago, I stopped taking my normal flu shot that I got every year because it was making me a little bit sick. And I seem to have problems with eggs now where I didn't. Like I'm 68 now and I ate eggs all my life. And now when I eat eggs, I feel yucky, so I just stay away from them. And one of the doctors down south told me, like, maybe you should just kind of, be careful with that, and I'm wondering what your views on that are. And plus, I've had people tell me that if you do take the vaccine for COVID-19, it does a good job of keeping you in better shape if you should get the virus and help you to stay immune from the virus. But I've heard that there are small amounts of metal in this vaccine, and also that it does mess with your DNA at all. So I'm just going to listen and let you comment on that.
Yeah, so there's no evidence that the vaccine interferes with your DNA. It's not possible based on my understanding of what this vaccine does, how it's manufactured, and the fact that if we're talking about the Pfizer and the Moderna vaccines, they don't even enter into the nucleus of your cells, which is where your DNA is housed. So I think that's just something that's been spread without any scientific foundation. What I will say in regards to COVID and with influenza, these are both viruses which we have repeatedly seen over the years actually kill people. And that's the sad reality of these viruses. And I don't mean to be so blunt, but people die who become infected with these. And as you increase in age, your risk of having a more serious infection also increases as well. Now, I'm not your age, but I'm not far behind you, and I have aches every day when I get up. I think that might just be the fact that I'm aging, and I'm happy to be doing that. But I still get my regular flu vaccine. I certainly have taken the COVID vaccine, and our kids have been vaccinated for everything they possibly can be vaccinated for, because I don't want to see anybody in my family or my children as being a statistic for something that's preventable. And in this situation, and in my opinion, the risks associated with the vaccine are much less than risks than not getting the vaccine. Sorry, and the fact that you took the vaccine for so many years and you tolerated it well would seem to me an indication that it might be something that you might want to reconsider. And Garth, just so everybody that's listening knows, influenza A and B have now been detected in the United States. And so it's only a matter of time before we actually see influenza make its way into Canada. So last year we didn't have much of an influenza season, but it looks like it's back this year.
Okay, we're going to take a... go ahead. Go ahead.
So now that I am not doing well with vaccines, what would your recommendation be, Dr. Blondo?
I would recommend that you actually have a sit down with your healthcare provider and discuss all of the issues that you believe are associated with the vaccine to make sure that they can guide you appropriately. The biggest concern with a vaccine is having an allergy to it, or if you happen to be unfortunate enough to have a rare side effect. But the rare side effects are in fact rare, and most people don't actually have an allergy to the actual active components of the vaccine. It might be to some of the carrier molecules that are in there. But I would sit down with your healthcare provider and have that discussion, and then make your decision based on the advice they give you.
Okay. Thank you so much.
All right. Thanks for your call. Okay, we're going to take a quick break for a news update and then back to our conversation with our guest, Dr. Joseph Londo, a microbiologist at Royal University Hospital. And Dr. Londo also teaches about infectious disease at the University of Saskatchewan. And any questions you have, give us a call right now. It's 1-800-716-2221. You could email bluesky@cbc.ca or reach us on Twitter @blueskycbc. We're also live streaming this on our Facebook pages. If you're following along on Facebook and you have a question, just put it in the comments section. We'll get to it as soon as we can. Right now, Tori Gillis has a news update for us.
Hey there, Garth. Premier Scott Moe has confirmed 6 Saskatchewan ICU patients are being sent to Ontario, and this is starting with 1 today. The Premier says case rates have been dropping, but hospitalizations and ICU numbers will remain high, so he says the government made that decision to send patients out now. As well, we're hearing from the head of critical care at Michael Garron Hospital in Toronto, who thinks it would be easier to move healthcare workers rather than patients. We'll hear from him coming up. And a COVID-19 outbreak at a retirement home in Regina has turned deadly for at least one resident. That outbreak was declared at the Marion Chateau home 2 weeks ago. The company that runs it said 9 residents have been infected to date. 4 of those people had recovered, but one of the other 5 residents has died with COVID-19. We'll have the very latest on that and more stories coming up for you in the news.
Thanks very much.
Thanks, Garth.
Tori Gillis on the news desk. Back to today's conversation. Again, our guest, Dr. Joseph Londo, a microbiologist at the Royal University Hospital and teaches about infectious disease at the University of Saskatchewan. Our telephone number again, 1-800-716-2221. Our email address, bluesky@cbc.ca. Our Twitter handle, @blueskycbc. We're also live streaming this on our Facebook pages. If you are following along on Facebook, just put your questions in the comment section. We'll get to them as soon as we can. All right, speaking of Facebook, we got this question from Fran on Facebook, and Fran writes, I'm curious, now that it's flu season and the symptoms of COVID and seasonal flu are similar, if you have symptoms and go to a testing site, will they be viral testing for both COVID and the flu?
So right now we're only doing that on a special request. So if we get a request from a medical health officer, or if somebody comes into the hospital, we'll do it. As we start to detect flu in the province, then the answer to that question is yes. Then we'll be simultaneously testing for both flu and for COVID-19. And depending on what else is circulating, we could be simultaneously testing for other viruses as well. So not right now, but yes is the answer.
Okay. Let's go to Jeremy on the line in La Ronge. Hi, Jeremy.
Hello, Dr. Jessica Rose. She's a Canadian statistician and a doctor. She says the vaccine injuries and deaths are off the chart. I sent you a file. I'm just wondering if you had a chance to look at it. There's over 20,000 deaths in the States and 728,000 adverse events. I never hear you guys talking about the blindness, miscarriages, Bell's palsy, blood clots, brain aneurysms.
Okay, Todd.
720. That's from the CDC VAERS site. CDC VAERS. Go
okay,
look it
Todd.
up.
Thanks.
I just went on to 728,000 VAERS adverse events. You're not telling the truth to Canadians, and you're poisoning people with the gene
And you're
therapy.
done now. Thanks very much for the call, Todd. Bye-bye. Let's go to Ivan in Balgony. Hi, Ivan.
Hi. I have noticed almost every day that I've observed the new cases, the new case counts on a daily basis. And my question is, why are the double vaccinated people or fully vaccinated people have a higher percentage of the total count than those who have only had one vaccination?
Mm-hmm.
I don't know the answer to that. It may just be a statistical anomaly at this point in time that will normalize over time. But I don't have I've looked at that data as well. I don't have a clear explanation for it. So I won't try and make something up. I simply don't know.
Okay. I thought maybe perhaps there were that many more people that were double vaccinated than those who had single, but no, the numbers are actually very close. The one day I saw that it was I won't even throw a number out there. I'm sorry.
Yeah, no, it is a little bit confusing right now, and over time that may normalize. But you're right, it is a bit of an anomaly, and I think we just may have to wait and see whether or not there's an explanation that emerges. But I don't have it.
Yeah, it's consistent from day to day. It doesn't change. Like 72% were not vaccinated at all, and 28%. CTV combines both numbers for the single and double vaccinated. No, sorry, for the single and non-vaccinated. And of the 28%, only 7% were single vaccinated, and the other 21 or 22% were double.
Yeah,
but when
you're looking at that, were you able to see any gender differences or age differences? Because I have not been able to tease that out.
Yeah, I thought perhaps maybe those who were double vaccinated were older because we focused on the older people.
Right.
But no, as far as gender breakdown, I have absolutely no idea.
No, and I don't think we could parse that from
out either. Yeah.
Okay. Well, thank you very much.
Thanks, but I don't have an answer.
Yeah, it'd be almost impossible to parse that out from what is being made public when we look at the statistics.
We need more in-depth knowledge to be able to see the breakdowns.
I got an email here from Connie. Connie writes, I'm fully vaccinated. Last shot was in June. I'm 57 and healthy, but wondering if I should get a booster before I reach the 6-month mark in December.
So you can only get a booster right now if in fact you fit in one of those groups that are recommended for a booster. Otherwise, I think you'll be denied. But do I think that we're getting to a point where a booster might be something that we want to consider? I absolutely do. But that's not my decision to make. But again, if you're an eligible person, I would say yes. If you're not, you're just going to have to wait until such an announcement is made.
While we're on that, what's the latest on getting the flu shot and your second or even your first COVID vaccine around the same time? Is there any contraindication to that? There
is not. No, if there's no reason for you not to take the vaccine, they can be co-administered at different sites. As I did check with one of my colleagues, that's part of the infectious disease response group in regards to the pandemic, and they said that absolutely that's a recommendation that's come forward.
Okay, I want to deal with this email from Lorraine because this has been going fairly viral. Lorraine writes on Facebook, I listened to a clip of the man who invented the PCR test, and he said it was never meant to be used to test viruses. It's not accurate and can't differentiate between viruses. So how can we know whether much of what's being shown as COVID-19 isn't just regular seasonal flu or a simple cold, which can also be a COVID virus?
Yeah, I guess I would disagree with whoever made that comment to say that was never for detecting viruses. PCR is based on identifying a unique sequence of nucleic acid, whether it's for cancer, whether it's for virus, whether it's for bacteria, whatever the case may be. And it's based on the premise that only that virus has that particular sequence, and or that short sequence. And you search for that sequence, you amplify it, you detect it. And we use PCR on a daily basis to differentiate between different viruses in the lab. We also use PCR to identify bacteria. We're using it now to detect parasites. So the applications are actually quite broad, and I think that probably the scientific community would disagree that PCR is not an accurate tool for detecting viruses. It most definitely is.
Okay, let's hear from Bob in Saskatoon. Hi, Bob.
Garth, Dr. Blondeau, very much appreciate your program. Looking at having a family visit from overseas. They will be flying. They are double vaccinated, and they will be traveling by air and ending up in Saskatoon. The rapid test, what is the timeline that we can follow or be guided by as to whether they picked up the virus while traveling?
Yeah, so, they're going to have a test still at this point in time for their arrival in Canada, either prior to getting here or when they arrive. And then it's recommended that they have another one 48 to 72 hours afterwards in order to make sure that they're not incubating something that they acquired on the way or that was missed by the first test. So that's kind of the timeline as I understand it.
So what I'm understanding then is that once they arrive in Saskatoon, whether they have their test prior to Saskatoon or at Saskatoon, it should still be approximately 48 hours.
Yeah, 48 to 72 hours. Some are recommending. This is an area that continues to evolve. There are some folks that are actually traveling, and if they have a negative test before they actually arrive in Canada, some would say they don't need another test afterwards unless their symptoms start to develop. But what I'm going to do, just to make sure that I don't give you misinformation here, is I'm going to actually double check this. And Garth, I will give this back to you to see if there's a formal recommendation, because I've heard 48 to 72 hours, and then there's some data saying that they don't need to be retested. But let's make sure we give out the right information.
Okay. Bob, leave your number with Corey, and we'll try to get that information back to you as soon as we can. Okay.
I'll find that out right after the show, and then I will give that information to Garth, just to make sure I'm giving you the right information.
Okay, Bob.
Thank you very much.
Thanks for the call.
You're welcome.
Let's move on to Marvin in Tisdale. Hi, Marvin.
I just have a reality question, Dr. Blondeau. Do you anticipate being on this show for the next 5 years, do you think? Or?
No.
I heard on the radio the other night that we are going to have this virus until the world gets vaccinated. And some countries, like Africa, they're only 3% vaccinated.
Yep.
So
yeah.
As long as we're not vaccinated, we're going to have this.
Yeah. So, back earlier in the pandemic, I think I was foolish enough to say that this would probably all be over someday. And then as the pandemic continued to evolve, I was saying, well, maybe it's going to become part of our seasonal immunization program. And at this point in time, my opinion is that we might see this remain seasonal, for some time. Whether that's infinity or not, I can't say. But you are right that so long as we have the virus spreading and there's still a large percentage of the global population unimmunized, then the likelihood the virus can continue to circulate is very, very real. So I think at this point in time, my opinion is that we're probably going to see COVID being part of our annual immunization program for the foreseeable future. I have no foundation to make that prediction. It's just what I'm guessing at this point in time based on what I'm seeing.
Yeah. Well, thanks. We haven't got the new viruses coming here yet, but the new variants. I think there's going to be a few more yet. Okay,
and that's likely as well. So you're welcome.
All right, Robert is on the line in Saskatoon. Hi, Robert.
Yes, good afternoon. Just wondering if we could have a few comments about the R value in Saskatchewan. I've heard recently that the R value has dropped below 1 in Alberta, but we never seem to hear about it in Saskatoon, and I just wonder where it is at and where it appears to be heading and where it's come from.
So the R value that you're referring to is the transmissibility of the virus within the population. So for COVID-19, when the pandemic was getting off the ground, if you will, the R naught value was somewhere in the range between 1 to 3. And I think at one point in time it was a little bit higher. I haven't seen the most recent R value, but I would probably think it's in that 3 range just because of the number of cases we've experienced during this fourth pandemic, maybe even a little bit higher. Like I said, to be honest, I haven't seen a new R value for it. And so what that means, just for everybody that's listening, is that the R value is the likelihood that one person would infect X number of other people. So if the R value is 3, that means one person would infect 3 more people. If the R value was 20, it would mean one person would infect up to 20 more people. And so for COVID, it's typically been in that sort of 1 to 3, slightly higher. So I suspect it's probably in that 3 range at this point, but I can't say that with any degree of certainty.
Okay, thanks for that. Do you have time for another question?
Yes, go ahead, Robert.
And it's just wondering if Sask Health has come out with anything in terms of booster shots for women who are pregnant.
I've not seen that, but I will ask. I know who I'm going to ask about that. It's a great question. I've had it before, but I still don't know the answer.
Okay, thank you very much.
You're
Thanks,
welcome.
Robert. Okay, folks, we've got a few lines open. The telephone number, 1-800-716-2221. Our guest, Dr. Joseph Londo, is a microbiologist and teaches 716-2221. You could email bluesky@cbc.ca or reach us on Twitter @blueskycbc. You can also follow along on Facebook today. We're live streaming this on our Facebook pages, both CBC Saskatchewan and CBC Saskatoon. If you're following along on Facebook and you have a question, just put it in the comment section. We'll get to it as soon as we can. But again, we have a couple of lines open, so do give us a call. It's 1-800-716-2221. Okay, we've got this question from Lorraine on Facebook. Lorraine writes, I have so many questions about this pandemic. One more is that if the vaccine doesn't prevent a person from getting the virus or passing it on, why is it the unvaccinated that are seen to be the danger?
So if you're vaccinated and you get this virus, you're most likely to have a mild disease or a mild infection. If you're unvaccinated, you don't have no protection whatsoever. So you're more likely to have higher viral loads, you're more likely to be symptomatic, and you're more likely to require elevated levels of care if it happens to progress to more severe infection. So vaccines are not perfect, but they do an important job, and that important job is essentially to keep you out of the hospital, which is what you want a vaccine to do. And that is where the strength of the COVID-19 vaccine comes in, or vaccines come in, is that they, while they're not 100%, they prevent you from developing severe disease requiring hospitalization. And so if you're comparing now the unvaccinated and the vaccinated population, the data from Saskatchewan, from Canada, from the United States, from the rest of the world clearly show that the numbers of individuals requiring elevated levels of care actually are in excess of 70, as high as 80% occurring in the unvaccinated population. So this fourth wave is being primarily driven by the unvaccinated population.
We're going to go back to the phone lines just a moment, but I do want to get your thoughts on this morning's news that we will transfer, I think it's 6 COVID-19 patients to Ontario. What does that tell us about what's happening in our ICUs?
Well, Garth, the government has been quite forthcoming in saying that we've got a lot of people in the hospital and our ICU bed capacity is being stretched to the max. And so what does that say? It means that if the government has a concern that, folks in some of our ICU beds are not getting the level of care that is required, that they need to look to alternatives. So it's sad that we've got to this point. It's absolutely sad. But if the government feels that it's in the best interest of patient care that these patients be transferred in order to receive that care, then I don't know that we can criticize that. But I would come back though, and I would say that part of our solution, and I know I'm sounding like I'm saying the same thing over and over again. Part of our solution here is to get that large percentage of the unvaccinated to step forward and get vaccinated, or else we're going to see new infections continue to persist for quite some time.
How risky is it to transfer an ICU patient given that they are amongst the most critically ill?
It is risky. This is not something that anybody would take lightly. There was a paper published in 2018 in the British Medical Journal that said that there's 3 key elements for transferring patients that are in critical care. The first being technical, that being the patient and the equipment, like what state is the patient in? Can they actually tolerate a transfer, particularly if they have to be transferred for a number of hours? The next is a non-technical aspect, which is the crew resource management, and then there could be some governance issues between hospitals, et cetera. But the big one is having the necessary equipment in order to make that transfer as safely as possible. Because technically, you could be in a situation where somebody who's critically ill could have a cardiac arrest, for example, when they're in transit. And so you have to have the personnel and the equipment in order to manage that in the event that this patient has a heart that stops beating. And so these are not decisions that are taken lightly, and these are delicate things to do. And we do have trained individuals in this province that have served for many, many years in terms of the transport of critically ill patients. Despite COVID, critically ill patients do get transferred on other occasions for non-COVID related reasons. And we do have a trained staff that are capable of doing that.
All right. Back to the phone lines. Valerie is in Saskatoon. Hi, Valerie.
Hi, everyone. Just wanted to give a shout out to all the public health nurses and occupational health nurses and everyone giving immunizations, because they are doing a great job. And I don't think we thank them enough. And yeah, Dr. Blondeau, you are, bang on the money. We need to keep educating people, and we need to get over our fears of the vaccine. Most of us, put things on our skin and our faces that are much more, well, we don't know what's in them, right? Sometimes we eat things that we don't know what's in, and yet we're worried about this tiny vaccine. And so I'm just shouting out to all my colleagues and thanking them for doing a wonderful job.
All right. Thanks, Valerie.
You're fantastic. Garth, I have an update for you. I just texted one of my colleagues. There does not appear to be a requirement for somebody to test themselves again once they arrive here, either 48 or 72 hours after. There's no requirement. A person might be interested in doing that just to make sure that they are infection-free, but it doesn't appear that there's a requirement for it.
Right, but they will need that test within 72 hours of arriving.
Yes. Yep,
right.
That is correct.
Yeah, okay. Let's hear from Devin in Regina. Hi, Devin.
Hi. I'm just wondering if it's possible to get a bit of information about the AstraZeneca vaccine. I find that there's lots of information out there about Pfizer and how long it lasts and booster shots and things like that. But I'm finding it really difficult to find anything about AstraZeneca, and quite a few people in this province had double doses.
Yep. Mm-hmm. So there's evidence that's available in the literature. The vaccine is still available. And what that evidence showed was that if you were immunized with the AstraZeneca vaccine, you in fact had a very robust antibody response. The issue with the AstraZeneca vaccine, in my opinion, became a political issue. It was not a scientific issue. I don't think there's anything wrong with that vaccine. And I'm not trying to slough off anybody that had a serious side effect that was associated with it. And if you had a mixed vaccine with AstraZeneca and Pfizer, once again, those individuals that were studied actually had a very robust antibody response. So I think there is some evidence out there. It's probably not as voluminous as you will find with Pfizer and Moderna, just because, at least in this country, the majority of vaccines that are given out at this point in time are Pfizer, then followed by Moderna. But the AstraZeneca vaccine was a good vaccine. It is a good vaccine. And I think if you've been immunized with it, then certainly you are no less immune than if you had received the Pfizer or the Moderna.
Okay, thank you.
You're welcome. Oh, I lost your sound, Garth.
Oh, no, there we go. Okay, this one's a little combative, but let's go there. Teresa writes, my big concern and question is why are doctors advised or actually told not to treat COVID patients with hydroxychloroquine and zinc?
Yeah, because there's just not an abundance of evidence to suggest that it makes a difference. As a matter of fact, that the evidence is not very good at all. So
okay. And while we're on it, ivermectin. What's the latest I've been able to find is the NHI in the States is saying we don't have enough evidence, and the WHO is saying clinical trials only. What's the latest?
So the evidence is that there isn't an abundance of evidence. As a matter of fact, there's really not any good solid evidence to indicate that it actually makes a difference. And in fact, the drug manufacturer Merck come out and said that they have not been able to review any evidence to suggest that ivermectin has a significant effect on people with COVID. So, if the manufacturer is saying there's no good evidence, you have to trust that they've looked at it all because they'd like to sell their medications.
Yeah,
so,
it certainly be.
Yeah, they'd have
their
an
best
incentive.
interest.
Yeah, right. So I think that if the trials come forward and show that there's some evidence that they actually works, then I think we've got a different story. But at this point in time, that evidence just doesn't exist.
Okay, let's go to the phone lines. I believe it's Dawn next. Hi, Dawn.
Hello. I'm wondering, should the booster shot be the same as your first and second shot?
I think preferably to avoid, I think so. Preferably, does it have to be? Probably not, but I think it's probably preferable that you just remain consistent.
Okay, and my second question is, will we be advised by the government when we become available for our booster shot?
Again, I can't speak for the government, but I assume that decisions will be taken both at the provincial and national levels with recommendations going forward for booster, and then I think they'll be made public, and we'll probably hear something about this in the coming weeks.
Very good. That's my questions. Thank you.
Okay. Thanks, Don.
You're welcome.
Paulette is in Pelly. Hi, Paulette.
Hi. I was going to ask your doctor about why once the patients are in critical care, could they not be using that same medication that was used to send people home after their TB that they had in the sanitariums? Because this really worked well to clear their chests.
Yeah. So at this point in time, there isn't a good home therapy for COVID-19. This could change if molnupiravir becomes an approved drug. And if a person is not critically ill, then it could be a drug that could be used in this patient population because it would be in a pill format. But for all of the medications that are currently available, they're all intravenous drugs, so they don't lend themselves as easily for home therapy.
Oh, well, I'm not talking about home therapy. I'm talking about therapy for these patients that are critically ill with COVID in hospitals.
Oh,
yeah.
Absolutely, they were IV.
Oh, yeah. So some of those medications are actually being used. So remdesivir is being used. We know that monoclonal antibody treatments are being used. We know that plasma with antibody is being used. And so that all of these options are being used in addition to antibiotics in order to try and keep these people alive. And in some instances, as we've come to learn over the course of the pandemic, people are dying and nothing could be done to save these. And other people are actually surviving their critical illness, which I think is a testament not only to critical care, but also to the availability of some products that have shown to be beneficial at certain points in time during their COVID infection.
Right. Okay, thanks.
Okay. Thanks for the call. One last question. This one came last time you were here and we didn't get around to it. Stephanie asks, would a short circuit breaker lockdown help stop the transmission of the Delta variant enough to maybe reduce the pressure on the healthcare system? What are your thoughts?
Yeah, of course. I mean, if we restrict people's movements and gatherings, then it reduces the likelihood for transmission. And that's based on the assumption, of course, that everybody's compliant. You can have all of the lockdown regulations that you want, but if people are still going to be non-compliant, then the virus will still spread. But yeah, could it be something that could work? Yes, of course.
Okay. Well, Dr. Blondeau, again, the time flies. Thanks so much for sharing yours.
Yeah, it's my pleasure as always. And be safe. And once again, folks, if you're not immunized, please consider getting out and getting your first dose.
Thanks again, sir.
Pleasure. You take care.
Dr. Joseph Londo is head of microbiology at Saskatoon's Royal University Hospital, teaches about infectious disease at the University of Saskatchewan, and tomorrow we're going to lighten it up a bit. Birdline tomorrow here on Blue Sky. Talk to you then. Bye now.